Okay, welcome. This is our career chat on careers in medicine. And we are very fortunate to have two accomplished center alums joining us from the field of medicine. We have Dr. Tao Lee. He is founder and CEO of Scholar RX, and he's also the section chief of allergy and immunology in the Department of Medicine at the University of Louisville. And we have Abby Winterberg, yes, she's also a center alum, and she is a nurse practitioner and clinical researcher at Cincinnati Children's Hospital. So what we're going to do, each of them are going to talk a little bit about their career path, give general insights, and then at the end, there's going to be time for you guys to ask them questions directly. So be thinking of what you'd like to ask them. And we kind of drew straws, and I believe we decided Abby was going to kick us off. Is that correct?
Yes.
Okay. Welcome. Thank you.
Great. Thanks so much. Good to see everybody. So I'm Abby Hess. I'm, as Kirk mentioned, I'm a nurse practitioner and researcher currently at Cincinnati Children's Hospital. I was at Centre College from 2001 to 2005. And when I was at Centre, I studied psychobiology, was my major, and that I think it's been relabeled as behavioral neuroscience now. And I always had an interest in healthcare careers in general, but when I graduated Centre, I still wasn't quite sure where I wanted to go in the healthcare field. I think something that constantly inspired me to keep looking for that ideal role for me was interacting with our professors at Centre. You know, I saw how much passion they had for their careers and for teaching, even subjects that I didn't love the most, like physics. You still could have professors who were absolutely amazing at teaching and engaging you. And so I really wanted to seek out a career where I had that same level of fulfillment that my Centre professors had in their careers. So when I graduated Centre College, I began working at Cincinnati Children's. I took a position as a research assistant, which you typically need a bachelor's in science to do. And I was working in a genetics research lab with a professor who had a PhD. And really, I enjoyed the job. I didn't want to do research in the basic sciences, but it was a really great introduction into research. And while I was working there, it gave me the chance to explore all career paths that I could in the medical field. And so I met with physician assistants, I talked with medical doctors, I shadowed nurses, I looked potentially at doing a PhD. I kind of just took a few years to really just explore everything while making some money and learning about the career hands-on in healthcare. And ultimately, I had a colleague who was going back to nursing school. They have accelerated nursing programs that are, you do some prerequisite coursework, but then at that time, they were 15 months to get a bachelor's in nursing because I already had a bachelor's from Centre. And so I just loved working with nurses and really enjoyed the shadowing opportunities and loved that there was just so many different directions that you could go in the nursing field in terms of different roles that you could have. And so I went back to nursing school. I continued working at Cincinnati Children's this entire time while I was in nursing school, so they helped pay a lot of it, which was super nice. Some employers are great about tuition reimbursement for graduate school, which is awesome. And so from there, I finished up my bachelor's in nursing in 15 months, began working as a registered nurse, and then went back at the same time to get my master's to become a nurse practitioner. And so the nurse practitioner role, I'm a family nurse practitioner, so this is a very diverse role. You know, out in the family or out in the community setting, you oftentimes are maybe doing something similar to what a family medical doctor does. There are some different laws and kind of regulations in terms of what you can do with your practice depending upon the state. But in the hospital setting, with family nurse practitioner, we work in really all settings across Cincinnati Children's Hospital in collaboration with our physicians. So I work with the Department of Anesthesiology, and our nurse practitioners manage our pre-anesthesia consultation clinic. So we basically are making sure that patients are safe and ready to go to surgery. If they're not, then we refer them out to other specialists. We may order diagnostic tests to ensure that everything is ready to go. And then, so I still work as a family nurse practitioner, but back in 2012, our hospital offered the opportunity to be able to go back and get a doctorate in nursing practice. And so while I was continuing to work as a nurse practitioner, I enrolled in the program to pursue my doctorate also. And so that's where I am now, is that I have a dual role where I work as a nurse practitioner in clinic 3 days a week, and then I do research and innovation work the rest of the time. Was there anything else, Kirk, that you think would be helpful to share right now?
No, it's up to you. If you have any tips about being in center or any particular experiences you think that might stand out, that could be good.
Sure. I think at center, I'm glad that I had the background that I did from Center College. I could have gone to a different university and gone straight 4 years and been a registered nurse at that point. But I think my career would have taken a very different path if I had gone straight into nursing. I think having the background, psychobiology, and then all of the opportunities that you have at center. So studying abroad, I think that certainly impacted my career. I'm collaborating with hospitals internationally on my research work that I'm doing. And I think that was really just a natural fit, because I've worked with people from other countries multiple times. And so it was very, easy to say, great, let's see if if the types of work or the type of tool that we were working on, if that could apply, across the world. So some of that work has been translated. So I think studying abroad is a super helpful opportunity. I also did an internship while I was at Center in genetics research. And so that was really what led me to my first job at Cincinnati Children's, and really gave me a strong foundation and an interest in research. And then my major of psychobiology, I think that really has been a great foundation for the work that I'm doing, because my research is really focused upon pediatric anxiety prior to medical procedures. And so a lot of the work that, the coursework that I had from psychobiology has really been a good foundation for the current research that I do.
Okay, thank you, Abby.
Sure.
Dr. Lee, you're up.
Great. Hi. Nice to see everyone. Really delighted to speak to you guys. So, my time at Center was from 87 to 91, so I graduated with class of 91. When I was there, I was biology and French double major. I kind of came to Center knowing that I was very interested in healthcare, because my father is a physician and my mother is a pharmacist, who is also now a physician as well. And so right from the very get-go, I was very active in the Pre-Med Society and was the president of the Pre-Med Society in my senior year. I'll just say, SNY, my other connection with Center these days is I serve on the board of trustees, and so I'm on campus once or twice a year, and do keep in touch with some of your faculty, blanking on our name, including the person who's advising your Pre-Med Society as well too. So those are my current connections. In terms of again, just my thought process as I was at Center. While I knew I was very interested in healthcare, I wanted, I was very conscious that Center gave me avenues to explore other things. I really enjoyed a lot of my humanities classes, my language classes, certainly the French education with Dr. Charles Volkamp and others. I also took the opportunity to explore other subfields in biology. And so I really loved invertebrate biology, actually, for whatever reason. And gosh, if I didn't go into medicine, I thought maybe I could make it in marine biology. I was always fascinated by Jacques Cousteau and all that when I grew up. But we're kind of a little far from this ocean. But you might have heard in the past we had the center term or some of those things down in the Caribbean and whatnot. And so there were opportunities. I did one to the Amazon actually and to the Galapagos, and that was just an amazing experience. But at the end, it was the medicine that drew me back. And at Center, at least through the Pre-Med Society, did a lot of shadowing and so forth. And that kind of solidified my interest in working with patients, working with others to provide comfort and care. And I thought the Pre-Med Society, at the time did a great job in helped me explore those opportunities, in healthcare, and then solidifying my interest in pursuing medicine. When I applied, I had, at that point in time, I had grown up most of my life in Kentucky. My family is originally from Elizabethtown. In fact, that's where I live now. So I'm actually just down the road from you guys, just a little bit. So I decided, I really want to go out of state. And so, I took a chance and, applied to a number of places outside of Kentucky, and was very fortunate to be accepted to University of California, San Francisco. Now, while that school doesn't quite have the same name recognition, perhaps, as say some of the East Coast schools or whatnot, it's currently ranked number 3 or 4 in U.S. News, and I think generally has one of the top one and number 2 or number 3. They're switching between Hopkins and so forth with regards to NIH funding. So it's a very, very strong biomedical research center. But it also has, UCSF also has a great, at the time they call it the biopsychosocial model, the Engels model. So basically, a humanistic approach to medicine, so that humans are not just vessels that carry a disease or condition. Humans are humans. We relate to each other, and there is as much of an art to medicine as there is a science, and that's one of the major things that I got out of UCSF. When I was at UCSF, I felt my center training, my broad training in liberal arts, was extremely helpful. And to me, it was actually the non-science components to my liberal arts training that I thought really helped me relate to my classmates, to the faculty, to what I wanted to learn, and how my career trajectory, started to shape. Initially when I came to UCSF, I thought, hey, my career goal is to become a primary care physician and serve in a small town, because those were the models that I knew. That's what I learned. Seeing my dad practice and his colleagues practice in a solo traditional practice, and so forth. But at UCSF, there were these incredible opportunities to do research, to do things that were off the beaten path. I ended up becoming the editor-in-chief for the university newspaper, so ran a staff of 30 beat writers, 2 full-time staff, managed a $250,000 budget, put out 20 tabloid editions of the newspaper while being a full-time medical student. And I think, again, I give credit to my center education for allowing me to, be able to blend science and writing and journalism and so forth. So it was a great experience. I ended up actually, that experience in journalism, and actually led to what at the time a splinter interest in education, and I started working on textbooks, mostly for medical board prep. So obviously, to become a licensed physician, you have to pass a number of licensing exams, and so I started working on a book at the time that eventually became the leading, and is still the leading book for medical test prep. So I don't know if you guys have any siblings or friends who are in medicine, they might know this book. It's called First Aid for the Userling Step 1. There's about 10 books in the series, and there's about probably 2 million books in print. But again, that was that while that was really serendipitous, I think I was in a position to be able to take advantage of that opportunity for education and learning and teaching, because again of my liberal arts training. So in any case, after when I was at UCSF, it's a 4-year, obviously medical school is a 4-year program. At the time, it's very traditional, 2 years of preclinical, biomedical education, pathology, anatomy, that type of stuff, then followed by 2 years of clinicals, where you rotate through the wards at various hospitals, San Francisco General Hospital, and the VA, and so forth, that you took care of a lot of patients. I got to do a lot of stuff, deliver a lot of babies, just some fantastic clinical experiences. And then I settled on internal medicine. Again, I thought, at the time I was thinking maybe I'll still do some primary care, but internal medicine is also interesting because you can also, from the internal medicine training, springboard into a number of specialties if you like, such as cardiology, GI, pulmonary, respiratory, critical care medicine. There's a lot of different angles. And so I went through something with a couples match with my fiance at the time. She was at Vandy Med School. And so we ended up at Yale for internal medicine, and she did pediatrics at Yale New Haven Hospital in Connecticut. And that's 3 years. So of training. And then after that, again, this is where things get a little complicated. I was mentioning, Abby, I'm not your typical physician. I did a venture-funded startup in medical education technology, received several rounds of funding, ran a startup out of LA for a couple of years, did that for a while, then came back to academic medicine, did an allergy immunology fellowship at Johns Hopkins. My father was an allergist. I was always interested in asthma. I was always interested in asthma as a condition, and how, how it affects patients. Allergies run in my family, so it's something that is a condition I'm somewhat familiar with. So allergy immunology is one of the specialties that really take care of that, and in addition, obviously, to the primary care folks. Abby obviously has probably taken taking care of quite a few asthmatics herself, I would presume, as a family nurse practitioner. I see you nodding there.
Every day.
I'm sorry, every day. Yeah, it's a very, very common condition, and we often collaborate with our colleagues, particularly for very difficult to treat cases, or folks who need, exotic biologics, for that particular condition. So I also stayed on at Hopkins and did a master's in what's called a master's in health sciences. Basically, it's clinical outcomes research. So I was very interested in the social determinants of social determinants of patient adherence to treatment plans. So in other words, what would predict whether, if I was treating a patient, I say, hey, you need to take this inhaler, would they actually do it or not? Because the number one reason why asthmatic patients often fail treatment is they just don't take their treatment. Adherence rates are roughly about 50%, almost regardless of what you do. It's a very challenging situation. And so Baltimore having a very socially, economically diverse population, including a lot of populations at risk, we were very interested in particularly underrepresented minorities, African-American populations, Latino populations, because they tend to be most at risk, especially if they were not, especially if they didn't trust the system. There wasn't enough trust and relationship with the system, right? With people that don't look like them, that don't talk like them, and so forth. So that was my research interest. But after I finished that work, I actually moved back to Kentucky with my wife, and I did two things. I got a part-time faculty position in the University of Louisville in allergy immunology. I also worked part-time with my father in allergy immunology in our practice in Elizabethtown, but at the same time continue to do works, in textbooks and whatnot. And then while I was a fellow, I started another company called ScholarRx, and basically that's essentially an online digital medical school. Over time, the education component is what I ended up focusing most on. In terms of the ability, the opportunity to impact the lives of tens of thousands of medical students and physicians around the world through education. And so that's been a bit of my trajectory. And again, I tie it back to my center education in the sense that being able to switch from an academic to an entrepreneurial mindset, was made easier by having that very broad education at center. So I'll pause there.
Thank you. Thank you. That's good information. So this is your chance to ask them questions. Does anybody have them? Don't be shy. I'll start off as I usually do. What advice, you guys talked about internships and whatnot, and we helped with that, but what are your thoughts on getting experiential education related to a medical field while you're an undergraduate?
Abby, you want to go first, or I'm happy to go?
Go ahead.
Okay, sure. Raise your, for those who are interested, are you guys involved in your pre-med society or pre-health society? I don't know, they still call it pre-med. Is it still called pre-med or pre-health?
Pre-health.
Pre-health, okay, gotcha. So yeah, no, my treasurer, Susan Epperson, went into became a nurse practitioner herself. So, we had all kinds of folks interested in pharmacy, PhD actually, folks too interested in, post-grad type, work, biology and molecular biology, that type of stuff. So I am a big advocate of getting some experiential learning. At center in the day, it was mostly, doing rotations with, local physicians, occasionally doing rotations or shadowing at Ephraim McDowell. I assume those connections still persist and so forth. And really using kind of a case-based learning model to really, get a feel for what's going on. And so when we say case-based learning, it's really, starting off with the patient experience, patient context, sometimes what we call the patient narrative. What's their story? What's their backstory? Again, they are not just, they are just not a vessel for a disease. They are a human being. They have a job. They have a backstory. They have family. They have fears. They have interests. They have aspirations. All that actually melds into, and really colors their experience and with health and disease. And so, that's something that's, I think, a wonderful opportunity to learn about as you, as you go through these rotations. Typically, in the past, I've done plenty of shadowing. So either you can, especially during the summers, you can do daily shadowing, especially if, say, for a family medicine or a primary care physician or a primary care health provider or a specialist. They typically have a daily clinic and whatnot, and you can shadow. Often you get to initially you're usually listening to the stories. Occasionally, but as time goes on, and as you hopefully develop a relationship with the healthcare provider you're shadowing with, hopefully they'll let you ask questions. You learn how a healthcare provider can gather a story and really start to make decisions about where do I need to learn more about this person? And then where do I need to start examining this person? You know, and then you learn a little bit about what we call the clinical reasoning process or the critical thinking process, you know, in healthcare. You know, and often you'll be allowed to do part of the physical exam. So for example, for my students that rotate with me, even high school students, I will let them do, you know, heart and lung auscultation, obviously under supervision, and direct observation, you know, look in the ears, you know, that type of stuff, help interpret blood tests, explain what the blood tests are, you know, those types of things. And again, you know, I think, you know, and then the other area where shadowing is really helpful is really getting to the why. And so there is a video that if you haven't watched, I strongly recommend you watch. It's called Start With Why by Simon Sinek, S-I-N-E-K. It's actually a video about, you know, anybody who wants to achieve anything really, and there's a bit of a slant towards entrepreneurialism, but I think it belies, you know, anything we do or want to do in career, which is start with why. Why do you want to become a doctor? Why do you want to become a nurse practitioner? Why do you want to do a PhD and so forth? There's always the why. Once you figure out the why, then you can get to the how and the what's, you know, but it starts with the why. And so I found, you know, it very useful to be able to ask the physicians, well, why did you choose this? Why did you choose that? Why didn't you just want to do that? You know, that could have been easier. Maybe that made you, that could have been maybe more financially rewarding, but you chose to do something that wasn't, you know, da-da-da-da-da. And so that really helps, you know, help you develop and get in touch with your core values. You know, what really resonates with you in terms of what you want to, you know, what impact you want to have down the line. And so, so I would say take advantage of that type of relationship as well too, with shadowing. And I'll stick there because obviously there's a lot of other services. I'm sure Abby has plenty of experiences to share. So Abby.
No, I think that's great advice. You know, really being able to get into a clinic and not just see what they do, but also talk with the physician, nurses, you know, away from the patient, of course, about why they chose that field and what particularly attracted them to it, what they still love about it, what are the challenges. I can remember one of my first shadowing experiences with the DO, and I thought, I've been to the doctor how many times in my life, but standing on the other side, this feels completely different because I'm thinking in a totally different way as the healthcare provider, or as opposed to from the patient side. So I think getting those direct experiences with shadowing is awesome. I think definitely internships are fantastic too. I think I knew within about a week in the research lab that probably wasn't exactly what I wanted to do with my career. You know, test tubes and mice and that type of thing just weren't as personally fulfilling for me on a daily basis, but I was so excited about it because my principal investigator who was running the study was so excited to teach me, and I learned a tremendous amount. And all of those skills have translated into the role that I am excited every single day to get up and go to work and see what's next kind of thing. So I think every experience that you can get from other people who are in the field, it really builds upon your knowledge of you and what you would be excited to do every day. And that'll change too. I think that may be different when you graduate than in 10 years or 15 years. My role's certainly evolved and changed and built, and that's part of the fun of it, I think.
Yeah, I agree. Let me add something with regards to doing research. Research helps us understand the how. You know, so if a patient has shortness of breath, you know, how's that happening? If they're wheezing because they have asthma, why is that happening? And so forth. So it gets down to, you know, physiology, maybe there's molecular biology, there's what we call pathophysiology, right? You know, I mean, you guys have similar courses, you know, with anatomy, physiology, I presume it's at center. And so, you know, part of being, I think, the complete healthcare practitioner is really understanding the how and the whys as well too. And there's usually a mechanistic view. I'll let Abby speak for the nurse practitioner field. In medicine, there's a fairly strong interest in that. Again, as I mentioned, the first 2 years of medical school, there's a preponderance traditionally of what we call preclinical training. Again, like I said, anatomy, physiology, pathology, pharmacology, immunology, and so forth. Now, there's a big trend in moving, clinical education, really to the first year, because at the end of the day, most graduates of medical schools will, of course, be taking care of patients. But the interesting thing, at least in the medical space, is that at a lot of schools, a lot of your faculty, a lot of your professors are actually PhDs. So they're PhD anatomists, they're PhD neuroscience people, PhD immunologists, PhD pharmacologists, and so forth. And so they have a very strong interest in, helping you learn those mechanisms and so forth. So, keep that in mind if you're interested in particularly the medical allopathic or the osteopathic, as Abby mentioned, she shouted the DO, tracks, because you'll run into those PhD faculty. If you're interviewing, they're going to be asking about those types of experiences. And so lab experience can be helpful in terms of understanding the scientific method, how we generate hypotheses and solve for that, and set of experience, because that's their world. If you are interested in academic medicine, and Abby obviously is at an academic center, the scientific method still holds. But a lot of times again, in my field, or at least in my work, and it sounds like in Abby's work, a lot is with patients, so clinical research and doing patient trials and whatnot. But again, you're setting up hypotheses and so forth, and you're studying the interventions, and you're looking at the outcomes and so forth. So research experience is helpful, and again, it helps. Because you are going to be talking and interviewing with academicians, some which are PhDs. That gets you on the same. That provides you with similar vocabulary and a shared experience. I don't know, Abby, if you want to add anything about that, since you're at an academic center with. Actually, it's Mark Rothenberg, and he has an MD PhD.
Yes. My principal investigator, the second one that I worked with while I was in nursing school, had an MD PhD, and it was interesting to see that perspective, because every time that she came with what we were doing in the lab, there was always the why we were doing it too, because it directly impacted her patient population that she was caring for with a rare type of diagnosis. But for me, that was where I really got excited in research, is when I worked with her, because every goal that we had a direct translation to human problems, and I was like, this is cool. This is what I'm really interested in.
Absolutely.
Yeah. I have a question for Abby. So I wanted to know, what nursing schools did you attend for your accelerated BSN and then master's? And I also have a second question, I guess. So obviously you work at a children's hospital. What made you choose the FNP over like pediatrics or something else?
Sure. So I went to the University of Cincinnati for nursing school. It was super convenient because they're right next door to Children's Hospital. And so I was able to continue working in the research lab at the same time that I was doing my clinical rotations and my academic education for nursing. So UC was perfect for that because I wanted to continue working. And then what was your second question? Sorry.
Where did you do your master's? Did you do that at UC as well?
Yes, I did my master's. Actually, I did my doctorate at UC. My doctorate, so Cincinnati Children's was looking to get additional nurses involved in clinical leadership, as well as sort of some of the translational research, but really being able to translate, evidence that's out there into clinical practice. And so they were willing to fund, I think about 10 of us to go back and get our doctorate at UC. And so I was able to do that.
And then the last little part of that, sorry, what made you choose family nurse practitioner over something else?
Sure. I've always loved pediatrics. I think since I was a kid, I was a young teenager and babysitting kids and just always, loved interacting with children. But once I got to the decision-making part of where you had to pick pediatrics, or family. So Cincinnati Children's specifically has a lot of adult patients still. So pediatrics can see up to the age of 21 for nurse practitioners in Ohio. We have a lot of patients who have congenital medical conditions. A lot who have congenital heart issues, that they were born with, and the adult world isn't quite sure what to do with some of their heart conditions, kids with cystic fibrosis, kids who have Down syndrome, some who have different other sort of rare genetic conditions. And so as a family nurse practitioner, I'm able to take care of every patient at Cincinnati Children's, both pediatric and adult. So that was ultimately why I decided to go the family route.
Thank you.
Absolutely.
Any other questions? Yeah.
So I was told that nurse practitioner and physician assistant is similarly equal. Can you explain more of the responsibilities you have different from a PA?
Sure. There's a lot of similarities, I think, between physician assistant and nurse practitioner. What I found particularly in Cincinnati is that we have more nurse practitioners because there's more nursing schools. For a while, I think there is one PA school in Cincinnati, but for a while there weren't any. So like at Cincinnati Children's, we have somewhere between 200 and 300 nurse practitioners, and I think we have somewhere between 20 to 30 physician assistants. And I think that's just because of the educational model. It's not because one is necessarily better than the other. But it's state by state, and that's true for nurse practitioners. I believe it's true for PAs as well, is that there's different scopes of practice in different states. And so depending upon what state you're in, that might dictate, are you allowed to see a patient without a collaborating physician, or do you have to have a collaborating physician? And what medications that you're able to write. And the schooling's a little bit different. I think the PA is a little bit more similar to the medical school model, just in terms of how it progresses. Whereas nurse practitioner, most, not all at this point, but most go through and have the registered nurse degree as a bachelor's first, and then you progress on to a master's as a nurse practitioner. Whereas PA, it's straight to PA. But I really liked it. Initially, I was kind of insulted that I had to go and get another bachelor's. I was like, I don't think I need another bachelor's. But then I realized it was a completely different set of knowledge and skills than what I already had. And then I was super thankful that I was able to get all that clinical experience as a registered nurse for 2 years while I became a nurse practitioner. It was so much easier to do the NP degree once I had already seen and interacted with patients and our entire medical team. Do you have anything to add to that, Sal?
Yeah, in terms of clinical responsibilities, even the difference between physicians, practitioners, and sorry, did my audio video freeze?
You're sorry. You're back.
Yeah. So Kirk, was the question, what are the roles and responsibilities? How are they different between physicians, nurse practitioners, and physician assistants?
Correct.
Yeah. I thought Abby gave a great explanation. Certainly, from the perspective of the physician side, obviously it's a longer road, in terms of the training. Again, minimum 4 years of medical school, typical 3 years of residency training, and then maybe 2 to 3 additional years of subspecialty training, which is what I did. I did a 3-year allergy fellowship on top of 3-year internal medicine and so forth. These days, especially with, and again, love to hear, Abby, your take on this, and I'm sure you're seeing this. There's a big move towards what we call team-based healthcare, which means that we as healthcare providers don't work in isolation. We work as a team. There's usually some coordination and so forth, and that means people on a team, whether you're a nurse practitioner, physician assistant, nursing, physical therapy, social work. We all have our roles in terms of providing a multi-touch, hopefully healing experience, for the patient. It's a model that's challenging because our again, Abby, please jump in. Our healthcare system, unfortunately, in terms of the infrastructure, the bureaucracy, and the logistics, is very fragmented. It's very hard for us to, if Abby saw a patient and then she sent that saying, hey, maybe this person needs a food allergy workup or something like that. Getting the information back and forth isn't the easiest, especially if we're in different health systems and whatnot. But there's a lot of work that's being done to try to break down those barriers. But again, so in terms of roles and responsibilities, agree with everything Abby said. And again, there's this team-based thing, and which also means that if you ever go to medical school or pharmacy school or dental school or nurse practitioner or PA, most of these schools are now starting to add elements of what we call interprofessional education, because we all know that we're not Abby's not just working with just other family nurse practitioners, and I'm not just working with just other doctors. We're working with many professionals, and we need to understand what we all bring to the table. So, yeah. Abby, you have any thoughts on that?
Yeah, I think as you were mentioning, outside of our healthcare system, it's still challenging to break down those barriers with communication. I think bigger academic medical centers have worked really hard to be able to make that model work within their walls, which is awesome. And yeah, I mean, every day when I come to work, especially in the hospital setting, it's such a collaborative environment, and I rely on every other member of the team in all directions to be able to safely care for the patient. And so I think we each have our designated roles within that, but that communication and that collaboration, I think, is one of the most fulfilling parts. And I think it's also best for the patient too, just that everybody is really, able to look out for them together.
Yep, agreed.
Question, Nicole? Yeah. Do you think you were better prepared when you entered your accelerated bachelor's in nursing, and because you had already your bachelor's on your BNS? Yeah, BNS. And do you think it makes a difference if you go first to school of nursing and then get your bachelor's? Or is there like not a big difference when it comes to that?
Sorry, the audio was a little bit on there. Were you asking just in terms of preparation for nursing school, like going straight into nursing versus having a bachelor's ahead of time? Yeah. I felt 1,000% prepared for everything. I think in nursing school, centers education and coursework. I did do the pre-med classes as well, because I kind of was keeping my options open for that, though that never was that was never what I was 100% committed to. But going into nursing classes, it was fast and furious in the accelerated program. It moves, and you are seeing patients within a few weeks of being introduced to nursing school, which is like, oh wow, okay, this patient is partially my responsibility. You always have a clinical instructor to rely on. But I felt very, very prepared to go into nursing school. I think the rigor of the center curriculum made it so that nothing was beyond what I, felt like I could do. It was great preparation for that. I think beyond, back to what Paul was saying, I think beyond just being prepared for the medical side of things, some of the projects that I've worked on, one of the ones I'm currently working on is an innovation. It's actually a breathing controlled video game device that helps prepare kids prior to undergoing anesthesia. Because when you put a child under anesthesia, many times we have them breathe some air from a mask, and kids get really scared and fight that sometimes. And so I had an idea to develop a video game to help train kids to be more comfortable with the anesthesia mask. So when you breathe, it controls these little zoo characters in the game. And so that idea sounded like, oh, that's cool. That's something that could help kids. But all of the pieces that came after that, so writing an innovation grant, working with teams of engineers, working with computer programmers, just all these different disciplines. I think if I hadn't had that liberal arts education and just came straight through the nursing education, that would have been super intimidating. And it still was a little bit at times. But having studied all these other disciplines, I think you really learn how to, work with teams, which is needed no matter where you are in the medical field, whether you're doing innovation research or not. But yeah, I think there's a lot to be said for having that more broad background and then sort of focusing in. Does that answer your question?
Yeah, it does. Thank you.
Any other questions? No? Okay.
What advice do you guys have for going through the application process for nursing or medical school or any type of medical?
I think nursing is a lot more, I think it's a fair amount easier than the medical school process. My husband's little cousin just went through the med application process. I know that's a lot more involved, so I'll speak to that. I think for nursing school, at least when I applied, you had to take the GRE, you wrote an essay, and you had to have a GPA within a certain, I think it was like over 3.5. I can't remember exactly. It might depend upon the nursing school. But there's no big like formal national sort of process for nursing. It's school by school, and you can look on the website, and they'll typically give you sort of the averages or what you need. But most schools, I think it's the GRE for these accelerated type nursing programs.
Yeah, and I will put out the caveat that I'm far removed from the application process. I know I speak to colleagues who that's obviously more their job at the university. So I'll just say that the general, and you guys probably had hopefully plenty of talks or speakers on this. But again, the typical predictors for entry into medical school is undergrad GPA and MCAT and strength of CV with regards to extracurricular activities and that are meaningful, and as well as research plus minus plus publications. Those are the traditional things. As Abby says, with the AMCAS or the application system, there's still an essay that's your personal statement, obviously. In terms of any specific advice, especially I guess if you're getting into your sophomore, junior, into your junior/senior year, think about again making sure that you have meaningful experiences, and again, not to just check a box on your CV, but to really get to the why you are interested in medicine, if that's the career for you. Because again, people will challenge you and say, hey, look, this is a 10 to 12 year training path. It's got a lot of ups and downs, and do you really want to do this? And so why would you want to do this? There are challenges with medical student burnout, depression. It's not an easy path. There's the hush, there's the rare, but the rare, but it does happen with regards to medical student suicide as well too. It's something that we as a profession really need to get a better handle on. Again, due to the stress of the training. So try to learn as much about what happens after the entry as you do before, and understand, is that the right fit for you in terms of your calling. Obviously mock interviews are helpful. I remember doing a couple of those, and I think the Pre-Med Society set that up. There are services out there that can help you with your AMCAS essays and so forth. Again, it's not to dress up your thing. It's really to make sure that the authentic you shines through in that essay. They have to feel that they can connect to you, who you are, what you are inside. And so again, it can't feel contrived or artificial, that in terms of a gloss over, that type of stuff. So that's some general advice. Is that helpful, or do you need more?
Thank you.
Okay, we have about 5 minutes left. Would you guys like to make any closing comments? You don't have.
I would just say, I think healthcare is an amazing field. I think getting to help patients through on some of their most challenging days, especially I in particular love pediatrics. I think those who don't love pediatrics are like, oh man, the parents are so stressed. But I think, in pediatrics, having the parents is one of the best things in the world, because you have this personal advocate for this little person who is really there to work with you to make sure that, this kid has everything that they need and that instructions are followed. Sometimes I tell my adult patients to do something and you're like, I don't know if they're going to do that. But a lot of times with pediatrics, the parents are like, yes, like we really need to make sure that this kid is well taken care of. But I think, explore around in the different healthcare fields. If you know what you want to do, go for it. But there's so many different career options in healthcare. And I think they're just getting more and more diverse too. I think as both of our roles show, there's a lot that you can do with healthcare that's more than just seeing patients. And as technology gets more and more advanced, I think there's a need to have people that have these other skill sets that can cross disciplines and can think about our challenges in healthcare in different ways. And I think, you as center students and having the liberal arts education, I think you're uniquely positioned to be able to think in a different way about healthcare challenges. And it's a really rewarding career. And if you all think of any questions, I think the team has my email. So I'm happy to answer anything if something comes up later.
Thank you.
Yeah, I'll just echo what Abby, I think, was, what Abby eloquently said. Healthcare is a fascinating field with rapid evolution of what's going on in all the professional tracks, regardless of where you want to go. The landscape is shifting very, very rapidly. And so that's part of the excitement, because something's always going to new, especially, I was just at a conference a couple of weeks ago in Chicago, where we were talking about, how will doctors and healthcare providers and nurse practitioners work with artificial intelligence, right? We've heard much about the Watson's projects and so forth. Well, some of the hype is a little early. Some of the stuff is absolutely coming. How are we going to be using, augmented reality, as healthcare providers? Just amazing things that are coming down the lane. But also, while we're doing that, there's also the challenge to keep the patient front and center of us and not be hiding behind the electronic medical record and so forth. And so the humanism will always be something that, we as healthcare providers need to continue to prioritize, regardless of how things change and how much technology comes our way. I will, also kind of echo what Abby says, that, while she's on paper a nurse practitioner, I am on paper a physician, we basically have many careers, in our field, in research or, entrepreneurship or education or, or whatnot. And so there are many things that you can kind of, tack on or glom on. So I'm a physician and I do this, or I'm a nurse practitioner and I do this, but it all, works together. Again, just, with healthcare, because of the unique nature, you are dealing with people who are literally trusting you with their lives, right? It's a unique and awesome responsibility. And so again, this is one of the fields where I truly think that, you want to think long and hard about, again, the why and so forth, because there, like I said, while it's exciting, there can also be some long days as well too. And you got to make sure that, you're set up and you've got that long vision, because if you have that long vision that, hey, look, I really do care about these patients. They are what gets me, they're what that get me up every day. They bring excitement, gratification to what I do. If that's what gets, if those are the types of things that, along the types of, there's obviously more to it, but if those are the types of things that get you excited, then those will also get you through the bumps and the ups and downs of wherever these careers will take you. And again, I'm also happy to answer questions as well too afterwards. Howard, Kirk, and would need us to help. So thank you.
Great information. Thank you both.